As a patient, there are 3 surgical options for treating obesity. The one that's been around the longest is called the gastric bypass. These are all done laparoscopically, but basically involves making your stomach a lot smaller and rerouting the intestines a bit. The second option is laparoscopically placing an adjustable gastric band, which involves putting a belt around the upper stomach to make your stomach feel smaller without cutting the stomach. The last and more recent option that we've had at least over 10 years now is called the vertical sleeve gastrectomy, where most of the stomach is removed, but none of the intestines are touched and there's no belt placed around the stomach. But patients feel like they have a very small stomach, as like in the gastric bypass surgery. With each of the different procedures, weight loss is actually variable. Both the gastric bypass and the sleeve gastrectomy seem to allow for the most amount of weight in the shortest amount of time, achieving a patient's goal weight even within 9 months to a year after surgery. With the adjustable gastric band procedure, the weight loss seems to be less statistically, and it takes a longer amount of time to get that weight loss. Patients on average lose about 50 pounds in the first year versus 100 pounds in the first year with the other 2 procedures. Obesity shortens your life at least 10 years. Weight loss surgery, what it seems to do is it helps resolve a lot of the illnesses related to obesity, such as high blood pressure, diabetes, and even sleep apnea. Most patients who are on high blood pressure medications don't need to take them anymore. And a lot of patients with type 2 diabetes are off all their medications with normal blood sugar levels by the end of that year, where they're losing most of their weight. A lot of patients are sleeping better because their sleep apnea is better. They even feel like their sleep apnea machines are pushing too much air because they're really breathing much better on their own. So people feel like their quality of life, just doing activities that everyone takes for granted, seems to be a lot easier. After surgery, patients often feel they're alone. So we recommend and we refer them to go to our support group meetings. Support groups seem to really help the patients feel like they're not alone, and they have another person to talk to about any issues or any concerns or any emotional needs they may have going through this process of change. And one particular patient who, after losing 100 pounds in the first 9 months after her sleeve gastrectomy surgery, she was so excited that she decided she wanted to be a personal trainer and attend support group meetings to give back to what she got from our own support. I really like to say that our team provides total care from the first time we meet the patient at the first orientation session to a year later after their surgery, when they've lost 100 pounds and are the happiest people in the world because they can run now more, they're taking fewer medications, and they're able to enjoy life to a fuller extent.